Good morning to all our media partners, CHDs, and everyone who is watching on YouTube. I'm Jolo from the Communications Management Unit, and in our Kapihan today, we'll have a deep dive and in-depth look at the most pressing issues. Now we'll have a look at how the DOH is implementing programs to fight the spread of dengue, especially tag-ulan or rainy season na. So here to give us updates on the dengue program is Ms. Eileen Espiritu from the DOH Disease Prevention and Control Bureau. She is currently fulfilling the role of the program manager for the National Born Viral Disease Prevention and Control Program and the National Malaria Control and Elimination Program of the Infectious Diseases Division. Ms. Eileen.
Yes, hello. Good morning, everyone. Good morning to our media partners. So for today, I will be sharing the dengue updates in line with the Dengue Awareness Month. So for today, I will be sharing the following. First is the epidemiological data of dengue in the Philippines. Second would be the comparison between morbidity week 15. So that is 2020 versus 2021. The Philippine data trends on cumulative number of dengue morbidities and mortalities. The current dengue strategies during the COVID-19 pandemic. The promising innovations and best practices, key lessons learned, and our take-home message for community engagement. So for the epidemiological data, starting from 2018, the dengue morbidities and mortalities have greatly fluctuated. However, on August 6, 2019, the national dengue epidemic was declared in the country, wherein there is a spike in cases leading to a cumulative number of 437,563 morbidities and 1,689 reported deaths. In 2020, we had an 81% decrease in the number of cases compared to the last year, numbering to 83,335 cases with 324 deaths. This may be attributed to the implementation of the enhanced 4S strategies, namely search and destroy mosquito breeding sites, self-protection, seek early consultation, and support fogging or spraying only in hotspot areas where increase in cases is registered for 2 consecutive weeks to prevent an impending outbreak that have been strengthened in every household, especially when we are placed under community quarantine, wherein most of the people stays at home, which could have also led to a better water sanitation hygiene or wash practices, thus decrease the mosquito breeding grounds. For 2021, as of morbidity week 15, that is until April 17 of this year, we remain hopeful that a decrease in cases would continue, and of course, this must be partnered with an integrated vector control management and other prevention and control activities. So in order to see if there is a definite decrease of morbidities and mortalities from the previous years, we have compared the data from the same period, which covers morbidity week 15, cumulative data from January 1 to April 17 of 2020 and 2021. As you can see, there is a 56% decrease in morbidities and 55% decrease in deaths. For the data trends on cumulative number of dengue morbidities, we would like to show the current data trends on how they differed over the years. So as I've said earlier, we had an epidemic last 2019, so we can see a sharp increase here in 2019. So the same pattern can be observed for the mortalities. This slide shows the data trends on dengue case fatality rates. So as you can see, we were able to achieve our target of maintaining the case fatality rate of dengue at less than 1%. However, we recognize that we fell short in meeting the second condition or criteria of the target, which is to reduce the case fatality rate by 0.1% annually. Hence, we deem that we need to review and update the dengue clinical case management in order to fully obtain the annual target. As to the current dengue strategy amidst COVID-19 pandemic, we have heavily shifted to the digital platform. In line with this, the program has been making use of the digital age to distribute advisories to our regional offices or the Centers for Health Development for guidance and requested actions. Images flashed on our screens are the series of advisories on dengue infection relative to COVID-19 disease, such as the reiteration of the 4S strategies and guidance on anticipated outbreaks, among others, that have been released during the COVID-19 pandemic. Part of the so-called new normal is the use of virtual conference rooms. We continue our fight against dengue amidst COVID-19, so we continue the regular conduct of program implementation review via virtual platforms, wherein we call on our regional coordinators to discuss policy direction and operational strategies to see successes and gaps encountered. Also, we are continuously enhancing our information, communication, and education campaign materials, which are disseminated through quad media clusters such as radio, TV, newspapers, internet releases, and the likes. As you can see here, we have general information written in Tagalog, information regarding myths or alamat or facts or ang katotohanan, and introduction to the enhanced 4S habits. So the program never stopped thinking of promising innovation and best practices. First is the program enhancement. So by the virtue of Department Order number 2020-0670, dated November 9, 2020, the National Dengue Prevention and Control Program was expanded to the National Aedes-borne Viral Diseases Prevention and Control Program. So what does this mean? It means the integration of prevention and control, maximizing the use of available resources, and optimizing the use of intervention not only for dengue but chikungunya and Zika as well. Example of such are the integration vector management approach. In order to guide the primary healthcare facilities in handling suspected dengue cases, the department, together with the WHO, has developed the Dengue Rapid Advice Guidelines, such as mga dapat gawin kung nagkalagnat sa panahon ng marami ang nagkakasakit ng dengue at ang 10 kaalaman tungkol sa dengue. These were created with the aim of providing basic information on how to deal dengue cases that only require home treatment and when to spot severe cases for referral to the next level health facilities. So another initiative of the program is to identify the causes of increasing fatality rates. To properly assess these deaths, a standardized dengue mortality review guidance documents were developed together with the University of the Philippines, Philippine General Hospital. This serves as a supplemental guideline to the Department Memorandum number 2020-0536, also known as the Guidelines in the Conduct of a Dengue Mortality Review, and this shall serve as the basis for policy direction for the identified gaps and challenges. So last April 22 and 29, we had 2 training sessions with the Center for Health Development's Program Coordinator, Regional Epidemiological and Surveillance Unit Coordinators, and the health facility personnel such as medical officers, nurses, and medical technologists. So we will have another series of training which is tentatively scheduled on July 12 and July 17, 2021. We have also adopted international best practices such as in Thailand. So inspired by the Queen Sirikit National Institute of Child Health, the Department of Health, through Administrative Order number 2021-009 dated January 15, 2021, titled Guidelines for the Establishment of Dengue Centers of Excellence in Tertiary Hospitals, has selected 7 Level 3 or tertiary hospitals to be Dengue Center of Excellence, which are as follows. So Jose B. Lingad Memorial Regional Hospital, National Children's Hospital, Philippine Children's Medical Center, San Lazaro Hospital, Southern Philippines Medical Center, University of the Philippines Philippine General Hospital, and Vicente Soto Memorial Medical Hospital. So what does having a dengue center of excellence mean? It means that we are capacitating these hospitals to provide optimum patient care, to have an effective and efficient referral system, especially in severe dengue cases, conducting research and training, and more importantly, advocacy. Each Dengue Center of Excellence shall undergo 4-phase implementations for 4 consecutive years, which started last 2020, and they all shall be fully functional by 2024. For Phase 1, this shall run from 2020 to 2021, and this entails enhancement of service delivery component and development as training center. For Phase 2, this aims the conduct of research and technology transfer, wherein by 2022, the Dengue Center of Excellence should be able to provide supportive and conducive environment for research and establish a laboratory specifically for dengue research with available records and adequate staff. For Phase 3, this shall run from 2022 to 2023, wherein the Dengue Center of Excellence should be able to act as information center. And lastly, Phase 4, which shall run from 2023 to 2024, wherein the Dengue Center of Excellence should upgrade as one of the pillars for health policy advocacy. So what are the key lessons learned? First is the value of social mobilization and risk communication. We recognize that the LGUs and local communities are the backbone of the dengue response, that we at the national level cannot do this alone. We really rely on the help of the LGUs and active participation of members of the community. As to the risk communication, we have to proactively communicate every single information about dengue, such as the facts about dengue, how is it transmitted, and how to prevent severe infection. These are some photos during our interagency meetings or close coordination and planning meetings with the LGUs to discuss dengue prevention and response strategies. So more images of the information campaign efforts that are regularly being conducted by our healthcare workers at the community level to increase awareness about dengue. So as we can see, they are also wearing masks as part of the minimum public health standards to prevent COVID-19 infection. And of course, our enhanced 4S strategy against dengue, which are as follows: search and destroy mosquito breeding sites, seek early consultation, self-protection measures, support fogging or spraying in hotspot areas where increasing cases is registered for 2 consecutive weeks to prevent an impending outbreak. So in compliance with Department Memorandum number 2019-0316, community health workers conduct regular search and destroy activities of mosquito breeding places, and of course, they should always wear proper PPE to prevent COVID-19 infection. So as part of the integrated vector management, fogging and misting activities are being conducted in hotspot areas. We also have to note that there is proper timing for fogging and misting. This must be done in 4 cycles with an interval of at least 7 days per cycle. This must also be coupled with cleanup drive and of course the first S in 4S, which is the search and destroy mosquito breeding sites. Here we can see the community health workers are conducting larval trapping activities as part of the vector surveillance to determine the mosquito density in specific areas. So the DOH, as part of its risk communication strategies, conduct media engagement activities involving multi-sectoral agencies at the national and local levels. So a quad media approach is being adopted by different LGUs. So they created their own IEC materials. And they even made their own infomercials, such as this video originally made in Iloilo. So next slide, please, Carms. So second key lesson learned is the importance of active surveillance. Active surveillance enables the implementers to foresee possible outbreaks. Likewise, surveillance allows analysis and tracking of trends in dengue transmission. Part of the surveillance activity is strengthening laboratories for early detection of dengue disease. NS1 antigen test kits are being provided in the primary care facilities to test individuals who have signs and symptoms, especially in areas where recorded dengue cases are present. Remember, kung merong nagkaroon na ng dengue sa isang lugar, maaaring ang lamok na ito ay nakakagat pa ng ibang individual at maaari ding magkasakit ng dengue ang mga tao sa komunidad. So the third key lesson learned is the safeguard measure in the implementation of the new health innovations. The universal healthcare institutionalized the health technology assessment as part of standard government process to ensure transparent priority setting and informed decision making, wherein the implementation of new health innovation must ensure efficacy, meaning every new intervention must be effective on lowering morbidity, mortality, or prevent severity of the disease. And more importantly, it is safe for public health. Additional consideration must also be given to quality in terms of long-term value. It must be cost-effective, and we must be able to sustain the use of such health intervention. So for our take-home message, nakikita naman po natin na unti-unting nagbubunga ang ating mga ginagawa upang mapababa ang kaso ng dengue sa ating bansa. Patuloy nawa nating gawin ang enhanced 4S strategy, lalo na ngayon na papalapit na ang tag-ulan, upang masugpo natin ang paglaganap ng sakit na dengue. Sabi nga, dengue get out. Muli po, uulitin ko, ang 4S ay ang mga sumusunod. Una, search and destroy mosquito breeding sites. Suyurin at galugarin ang pinamumugaran ng mga lamok at sirain ito upang makasiguro na mamamatay ang itlog at kitikiti ng mga lamok. Ikalawa, ang self-protection. Ugaliing magsuot ng mga damit na nagbibigay proteksyon mula sa kagat ng lamok tulad ng long sleeves, pajama or jogging pants, at kung maaari ay gumamit ng insect repellents. Ikatlo, seek early consultation. Sumangguni agad sa pinakamalapit na pagamutan para hindi lumala ang sakit. Kung tayo ay natatakot sa banta ng COVID-19, meron na po tayong mga health facilities na tumatanggap ng teleconsultation. Maaari tayong tumawag sa kanilang mga hotline o bumisita sa kanilang mga social media accounts para sa karagdagang impormasyon. At ang huli ay support fogging or misting or spraying on hotspot areas para sa mga lugar na may pagtaas na kaso sa loob ng 2 magkasunod na linggo upang maiwasan ang outbreak. Huling paalala, sa ating pagsunod sa Enhanced 4S strategy, lagi nating isaisip ang pagsunod sa minimum public health standards upang maiwasan din ang posibleng pagkakasakit ng COVID-19. Maraming salamat po.
Thank you, Ms. Eileen, for that comprehensive presentation. So nakita natin sa presentation ni Ms. Eileen na our dengue program has adapted to going digital, especially with the COVID-19 pandemic, for information dissemination to help communities equip themselves with the right information to fight dengue. Tapos tuloy-tuloy pa rin naman yung programs natin to mobilize communities through the Action Barangay Contra Dengue and 4 O'Clock Habit. Let's move on po to the open forum na. So for the first question, let's have Caroline. Caroline.
Morning po, Doc. Doc, first of all, baka po pwedeng makahingi ng breakdown noong cases natin for January to April this year. Saan po itong mga regions or provinces pinaka nanggagaling, and then age group po?
Okay. Sige, thank you for your question, Miss Caroline. We can send it to you. We can send it through our CMU. We will get it to our Epidemiology Bureau because as of the moment, wala po kaming disaggregated data. Ang meron lang po kami is yun pong total number or cumulative number of dengue cases as to morbidities and mortalities. Pero come July, we have issued a memo to our regional offices na magre-report na sila dahil nga po papalapit na ang tag-ulan, babantayan na po natin ang ating mga kaso. So lahat po ng regional offices ay magre-report na po sa aming, dito po sa amin sa central office, sa program po, para po mabantayan po natin kung saan-saang lugar ang mga may matataas na kaso. So ito po ay magiging monthly reporting po nila talaga, tututukan po nila per barangay, per municipality po.
So wala pang data no kung kahit region lang na pinakamarami yung case?
Sa ngayon po, hindi po namin na-disaggregate yung data kung saan po nagmula yung pinakamatataas na kaso.
Okay po. Ma'am, just one more question lang po. Ma'am, may possibility po ba na mas marami pa dyan yung cases this year, pero hindi lang nakapunta sa ospital yung mga pasyente because of COVID-19? And in connection to this po, paano po yung gagawin natin sa hospital? Kasi dengue season na po, di ba ma'am, starting May. So, will you be suggesting, just like in the previous years before the pandemic, na magkaroon po sila ng, again, separate triage unit for dengue po? Thank you.
Okay. For the triaging, lahat, yun naman pong mga ospital natin po ay meron po talaga po silang triaging and sineseparate po nila yung COVID-19 cases sa ibang mga kaso na natatanggap po nila sa ospital. So, hanggang ngayon pa rin naman po ay sinusunod pa rin natin yung issuance natin na ni-release nung 2019 na magkakaroon din po sila ng dengue fast lane para po matutukan po ang ating mga pasyente na nagkakaroon ng dengue. As to your question with regards to dun sa possible na mababa yung kaso dahil hindi nakakapunta sa ospital yung mga pasyente, I think it is a possibility. Pero meron po kasi tayong tinatawag na mandatory notification wherein lahat ng kaso ng dengue ay kailangan po, kahit po ito ay sa rural health unit lamang or health center, kailangan po i-report po ito sa atin dito po sa DOH. So in compliance to that, reported po talaga lahat ng kaso na nagsisik ng consultation sa ating mga health facilities.
Opo, kasi ma'am, based din po kasi dun sa mga nakakausap natin, di ba? Yung ibang mga may sakit po. Hindi na, sa bahay na lang sila. So parang doon na lang sila nagpapagaling or anything. So hindi na sila nagsisik ng consult even with the health center. That's why I'm asking lang po if there's a possibility, ma'am, na hindi po more than this po yung number.
Yeah, oo. It's a possibility naman din po dahil nga po may fear po tayo na mag-sick mag-sick or mag-consult sa hospital yung ating mga kababayan. Pero kami po dito po sa programa, nais po namin ipahatid sa kanila na dapat po, dahil dengue po is a highly preventable disease, huwag po tayong matakot. Meron po tayong mga teleconsultation, tumatanggap po ang ating mga health facilities, kahit po yung konsulta lamang via telephone or social media, pwede po nila itong gawin para naman po hindi po magkaroon ng delay sa treatment ng pasyente. Kasi mahirap po kapag humantong tayo sa severe dengue na.
Okay, thank you, ma'am.
Thank you po, Ma'am Caroline.
Thank you, Caroline. For the next question, let's have Aiko.
Yes po, good morning po. Miss Eileen, we just like to also ask po, ano yung mga measures that help in the decrease of cases amid the pandemic? Nakakita po na tayo ng 50%, more over 50% na decrease, especially from January to April. So ano po yung mga measures na nakita po natin which help in the decline of dengue cases po?
Okay. Thank you, Ma'am Aiko. So, dahil nga po, ito pong pagbaba ng kaso po natin ay ina-attribute po natin din sa pagpapatupad ng Enhanced 4S strategy bilang ang mga kababayan natin ay nag-undergo ng community quarantine. So yung movement ng tao, nasa bahay lang po yung mga tao kasi isang factor din po ang movement ng tao sa pag-acquire ng dengue infection. So plus they are practicing the water sanitation hygiene. So yung mosquito breeding sites natin, hindi po nag-decrease po ang ating mga mosquito breeding sites.
Ma'am, just to make the public aware din po, is it possible daw po ba na, for example, maipasa ang COVID-19 through Aedes aegypti or a mosquito? For example, person is infected with COVID-19 tapos naikagat po yun sa another person. Is that possible po? Para lang ma-aware din yung mga tao if the transmission can happen through mosquito bites. Thank you.
Yes, ma'am. Ang COVID-19 infection po ay hindi po ito natatransmit via mosquito bite. Ito po ay respiratory droplets. So hindi po ang mga possible infection po na makukuha po sa kagat ng lamok ay dengue, chikungunya, Zika, malaria. Yun po.
And Sir Jolo, pwedeng last question na lang din. Okay. Miss Eileen, when it comes to the testing po ng mga may symptoms po ng dengue, ano po yung ginagamit natin na protocol for testing? Are we using rapid antibody or antigen testing for them to be screened with their symptoms po?
Okay. So, syempre, yung ating test for the dengue virus infection, we have available dengue NS1 antigen. We also have the dengue antigen antibody test for IgM and IgG. So those are the presumptive test or screening test for dengue infection. Pero pag gusto natin siyang i-confirm, kailangan din po natin siyang i-PCR or RT-PCR. So yun po is the gold standard for the testing of for the confirmatory test of dengue infection. So meron din tayong tinatawag na viral culture, so yun din po. Pwede rin po yun. Pero the commonly used is the rapid diagnostic test kit for antigen and antibodies.
Thank you po.
Thank you, Ms. Aiko.
Thank you. So if there's no more questions, let's have Caroline again. Caroline.
Ma'am, just one follow-up lang po. Yung pong weather natin, kasi di ba medyo delayed po yung pagtag-ulan, may possible relation din po ba siya dun sa cases natin from January to April? And since mukhang magtatag-ulan na po talaga this coming months, yun din po. Ano po yung magiging relation dun sa cases po?
Yes, Ma'am Caroline. That's a very nice observation. Yun nga po, wala po tayong masyadong ulan ng January to April. So baka kaya wala pa po tayong kaso. So ngayon po na paparating na po ang tag-ulan, medyo kailangan maging bantayan na po natin ang ating kapaligiran para hindi po dumami ang ating mga lamok. Kasi inaasahan din naman po natin sa panahon ng tag-ulan, which is from July, August, up until mga September, diyan dadami yung mga kaso ng ating dengue. So kaya ngayon pa lang nananawagan na po kami sa ating publiko na pag-itingin po natin ang ating Enhanced 4S strategy para maiwasan po natin ang sakit na dengue.
Thank you, ma'am.
Thank you po.
So that's all the questions we have for today po, ma'am. Final message po to our viewers po.
To all of our viewers, we want to let you know that dengue infection is a highly preventable disease. Kailangan lang po natin itong kailangan po yun pong ating mga vector which are the female mosquito Aedes aegypti ay matanggal natin sa ating komunidad. So paano natin ito maiiwasan? First, kailangan po natin search and destroy mosquito breeding sites. So yun pa din, sir, kailangan talaga natin na Napatayin, suyurin, galugarin ang mga pinamumugaran ng mga lamok at sirain ito upang makasiguro na mamamatay ang itlog at kitikiti ng mga lamok. Ikalawa, self-protective clothes. So ugaliin nating magsuot ng mga damit at magbigay na nagbibigay proteksyon mula sa kagat ng lamok tulad ng long sleeves, pajama, jogging pants at kung maaari ay gumamit tayo ng insect repellents. Ikatlo, seek early consultation. Sumangguni agad sa pinakamalapit na paggamutan para hindi lumala ang sakit. Kung tayo ay natatakot sa banta ng COVID-19, meron po tayong mga health facilities na tumatanggap ng teleconsultation. Maaari po tayong tumawag sa kanilang mga trunk line o bumisita sa kanilang mga social media accounts para sa karagdagang impormasyon. At ang huli, let us support fogging or misting or spraying on hotspot areas para sa mga lugar na may pagtaas ng kaso sa loob ng 2 magkasunod na linggo upang maiwasan ng outbreak. At pinakahuling paalala po sa lahat, sa ating pagsunod sa Enhanced 4S Strategy, lagi po nating isaisip ang pagsunod sa minimum public health standards upang maiwasan din po ang posibleng pagkakasakit ng COVID-19 infection. So yun lang, Sir Jolo. Maraming salamat po sa lahat.
That's it for our Kapihan today. Thank you, Miss Eileen, and everyone who joined us in this Kapihan. Ingat po kayong lahat.